You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
Welcome to Battling Opioids. I'm Jay Donnelly. Recently, I sat down with Javier Diaz, production manager, PBS 39, and he was telling me about his father's struggle with addiction while he was growing up.
Well, basically, my father struggled with heroin for the majority of my life. Actually, the entirety of my early years up until I was about 15. He was born in Puerto Rico. His mom died when he was 4. He was kind of orphaned and moved around. So one can understand how he went down sort of that road. But basically, he was on heroin, and he would try to get help, whether it was court mandated or not. And he went to Hogar Crea, which is a drug rehab in Bethlehem, Pennsylvania. And it's an intensive program. It's a 3-year program till you graduate. He would be there a year and then give up, or, then go back for 6 months. And so basically he was probably there for 5 to 6, 7 years, probably from my age of maybe 7 to like 14. So I pretty much grew up there. Seeing him on Sundays was family day, different events they had. So I grew up around a lot of gentlemen that were struggling with heroin addiction in the late 70s.
So how did that affect you as a 14-year-old? You said that when you were younger, he came out clean. Did it change your perspective on things?
It did. I mean, how it affected me before that.
Yeah, before, after, during.
Yeah, okay. So as a kid, you don't want to tell your friends that your dad is in a drug rehab or in jail. So, you kind of learn to tell stories. He took a job in Puerto Rico for 6 months. Why don't we ever see your dad? Well, he's down there another 3 months. So, but I'm pretty sure most of my close friends knew what was going on anyway. But, you kind of learn to, to get really deep. I mean, you kind of learn to be numb because, as a kid, you don't want to feel pain. You don't want to see your dad walking out the door knowing you might not see him for 4 days because he's about to go on a bender. So you kind of learn to bottle up all of your feelings, from sadness to anger to happiness to everything, because once you open the door, everything comes out. So not a good side effect. I've since dealt with that and gotten past that. But, seeing him get clean at Hogar Crea, which is a great program, was a source of pride, obviously. He came out. He was a leader there. He, ended up mentoring a lot of other, I guess they call them patients there.
Nice.
Yeah, so that was a source of pride. And, it didn't last, though, to be totally honest with you. He relapsed probably when I was in my 30s. So he had a good 15 years there, 14 years of being clean. And then he don't really know why, but he relapsed. And, he's I guess now part of what they call the opioid epidemic.
Your father is still with us, correct?
He is still with us, yeah. He's in sort of a hospice situation because he didn't really take care of his body. I mean, you can't be 60-some years old shooting heroin. And, now with the fentanyl, I mean, he had, this is an elderly man. He had probably in the last 5 years, maybe 3 overdoses. I spoke to one of the police officers on one of them, and he was the only one in the city of Bethlehem, besides another kid who was like 20 years old, to take 2 shots of Narcan to wake him up. So, he's in a hospital situation now, so he obviously can't use. But, it was sad to see, and I'm glad that there's awareness to this now because, for years and years and years, nobody cared, Once it started getting into suburbia or just the amount of people.
Amount of numbers.
Yeah, exactly.
So what advice do you have for a 14-year-old version of yourself to kids today?
It's really tough. I don't think it's possible, but the advice would be like, it's not you, it's your dad. You are not a reflection of what your dad, your grandmother, your mother, anyone who's struggling with this opioid. That is not you. You are you. You know, not that you have to broadcast it to everybody, but don't be ashamed, you know, and obviously use it as an example of what you don't want to do, which is what I did. I had my fun when I was younger, but I would never touch heroin or anything like that you could immediately get addicted to. And so I guess that's one silver lining. He has 2 sons that would never go anywhere near that stuff because of him. But the main thing is to realize it's not you, to carry on your life, do what you want to do. And, it hurts. It's sad. You don't have a dad there or mom or whoever. But, I mean, you have to carry on. And don't take the burden. Don't feel responsibility for what your parent or caregiver or loved one is doing. It's their choice.
That could be a big stigma for yourself, growing up, and then when you get older, is taking that burden on. Should I have done something? But I was so young, and.
Yeah, I mean, you do have those thoughts, and you try when you're young. Dad, don't go. We know where you're going. Don't go, and but you have no control over that situation. That's another thing to realize. You don't have control over it. Control the things you can, and don't worry about the things you can't control. But definitely try. I tried when he relapsed. I tried to talk to him. I didn't just throw my hands in the air and say, well, he's using again. See you later. But you can only try so much, especially once you get older and you have your own family and you have your own kids and your own wife or husband, whatever. You have to move on. You have to kind of separate. You do what you can, but, it's not a good feeling when your dad calls you up saying, can I get $20? Because you know what it's for. So I didn't used to give it to him. I mean, I'm sure I did once or twice, but, don't call me anymore for that. You have to set boundaries, I guess, is the overall message.
Is there anything else you'd like to add that we didn't cover?
No, I would just, if you're a child who's struggling with an adult in your life that has a substance abuse problem, talk about it, talk to your school counselor. I mean, I didn't tell teachers, I didn't tell anybody. It was a big secret me and my brother had. We didn't even tell our cousins. We have a family, and they all knew, but we didn't talk about it. I have 26 first cousins, and you're around them, and you can't even be yourself, because that is obviously a huge part of yourself, is what's going on with your parents. So talk about it to somebody.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/haveenough.